Hello, Everything Medicare Podcast Nation. Welcome to another edition and another episode of the Everything Medicare Podcast. And happy April. Today is the 1st of April, Monday. If this is your first time listening, my name is Christian Brindle. I'm your host of the Everything Medicare Podcast, where every single week we bring you a couple of podcasts where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. Thank you for being here. Thank you for listening. Today, folks, I am fired up, and I'm going to discuss a topic that I probably should have talked about earlier, but I'm going to talk about it now. That's the new Medicare cards that have been coming out. I'm going to have a little bit of a shorter podcast for you today. Reason being, there's not a whole lot for me to say on this topic, but I have enough to say to do a podcast that I believe will be able to help you. So, let's rewind the clocks a little bit here. Back to 1965, 1966, I can't remember which, but it's one of those 2 years that Medicare first entered our lives here in America, when it was finally put into motion. And when that happened, the Medicare cards had information to identify a person's Medicare information. If you're on Medicare, you already know this. There's always been red, white, and blue cards, and they've gone through changes here and there, but there's always been red, white, and blue cards called Medicare cards. And on them, they had when your Medicare Part A started, your effective date, and your Medicare Part B effective date, and your Medicare number. And that's typically the Medicare number is what physicians, providers, used to bill Medicare, along with some other basic information about you. When they started that, the Medicare number was your Social Security number. And it stayed your Social Security number for many, many, many years. Actually, up until the first time that they changed this was 2018, but I'll get to that in a second. So it was your Social Security number. Now, nowadays, that's preposterous. That's ridiculous. Well, it wasn't that ridiculous at the time because they used the Social Security numbers to identify a lot of things. Back then, I think it was I read up until the year 2000, people's college IDs were identified with their Social Security number. It just was a different world back then. And if you're listening to me and you're on Medicare now, you probably already know that. You don't need me telling you, but just to remind people what the world looked like back then. There really wasn't the technology and the computer access and the internet like what we have today. And so, it wasn't as big of a deal, I want to say, to have your Social Security number identify something that you carry with you every day. Stealing someone's identity wasn't as easy as it is today. It wasn't as easy to get away with as it is today. Now, fast forward. A lot's changed since then. Now we're in 2019, and starting last year, they announced that they were going to replace everyone's Medicare card. Nearly, not quite, but almost 100 million Americans on Medicare. Less than that, but getting closer and closer all the time. Tens of millions of Americans replace everyone's Medicare cards with a new card where everything was the same, slightly different design, but they were going to take the socials off and instead do like most insurance companies will do it, and put a randomized code on there to identify you and to be your Medicare number. Nothing that's specific to your identity or your Social Security number. Now, I understand why they started out doing it the way they did. I get it, because like I just explained, it was a different time. But it should not have taken them all the way until 2018 to realize that wasn't a good idea. It shouldn't. It's ridiculous. It's asinine. It's asinine, asa 10, asa 11. Whatever you want to call it. Now, moving in the right direction? Yes. We're going to talk about in segment 2 what you need to do, what you need to expect, and how this new process will work with the new Medicare cards and the new Medicare numbers. Stay right there. Welcome back, folks, to segment 2 of the Everything Medicare Podcast. I hope this finds you having a great Monday. I hope you had a great weekend you were coming off of. And welcome to April. And we are in spring. I know spring started in the last couple of weeks, but April is when it really starts to feel like spring, depending on where you're living. At least here in Utah, where I live, that's the case. So, today we're talking about Medicare cards and the new Medicare card. So this is what you need to expect. First things first, everyone was mailed a new Medicare card, or I'd say 90+% of the Medicare population has already received their new cards. Now, they were doing from, I think it was April to April or May to May. I don't remember. But I'd say 99% of everyone, if you've been listening to this and you're on Medicare, has probably received your new card. So this is what you need to know. Starting April 1st, I think, which is today, they will not accept the old Medicare number, so your social. The old Medicare number was your Social Security number with a letter after it, and the letter signified, like, if you were drawing off Social Security, or if you were a widow, or if you were drawing off your spouse because you didn't have enough working credits. There was a lot of things that the letters signified after your social. But if you still have the old card and you don't have the new card that they've sent you, or maybe it got misplaced, maybe you accidentally threw it out, you didn't know what it was, or whatever the case may be, you're going to need that. Because if Medicare is your primary insurance, meaning if you have a supplement, Medigap, retiree supplement from your work, or whatever the case may be, not a Medicare Advantage plan, but even if you have a Medicare Advantage plan, you'll need it at some point, if you ever plan on changing that plan. I'll talk about that more in a second, but you're going to need that new card because, first of all, the doctor's offices, once this change completely takes effect, which I believe is April 1st, but I could be mistaken, forgive me on that, latest May 1st. They will not accept the old Medicare cards. At doctor's offices, they won't be able to bill Medicare like that. They need to use the new Medicare cards with the new Medicare number. The socials won't be accepted any longer. So that's number one. Make sure you have your card, and if you don't, contact your local Social Security office and see what you can do about getting them a new one sent out to you. Or you can contact Medicare. Okay? That's the first thing. Number one, make sure you have the card. Number two, destroy your old card. Don't keep it. It's useless to you at this point. It means nothing to you. It's just a piece of paper that has your Social Security number on it that does you absolutely no good. Shred it. Don't just throw it away. Shred it. Make sure it's sufficiently destroyed to where you're not in a position where you're going to be taken advantage of. Okay? I've seen a lot of people, since they got their new cards, walking around with both cards, their old card and their new card in their wallets. Don't be that person. Don't do that. It was understandable in the past, the past 60 years, because if you got an emergency and you need to go to the hospital, you needed the Medicare card with you, sure. But now that you have this new card, the old card doesn't even work anymore. It makes no sense. You could lose your wallet. Someone could steal your identity just like that. You're in danger of that. And like I said, it doesn't even work anymore. Get rid of it. Destroy it. Okay? So number two, destroy your old card after you've made sure you have the new card. Step number one, make sure you have the new card. Step number two, make sure you destroy the old card. Step number three, the reasons why you need the new card, not just for billing. Let's say you want to change your Medicare health plan at some point. You can't do so without that new Medicare number. Period. Point blank. It's Very, very important, folks, that you take my advice on this. Stay with me into segment 3. Welcome back, folks, to segment 3 of the Everything Medicare Podcast. Like I said, this is a shorter edition. This is a shorter episode, a shorter podcast, but it's a message that needed to be talked about, because now we're in the end game here. You should have gotten the new Medicare card. If you haven't, you need to make sure you have one. And you need to make sure the old one is destroyed. Point blank. You need to make sure that this is a safe, easy, simple transition for you. Folks, I really, really appreciate you listening to us each and every single week, what we're trying to bring to you. You make this possible. You're the reason why we're able to help as many people as we can all over the country. And this is the best, most efficient way that I have found that we can bring our message to you. Otherwise, we wouldn't be able to reach you wherever you are, whatever state you might be listening to this in. Folks, if you'd like to work with me on your Medicare plan, let's say you're turning 65 and you're not sure which direction you'd like to go or what your options might be, you just feel like you need some guidance, or maybe you're already on Medicare and you're just not satisfied with what you have, or you want to see if you can do better. I work with people in 3 states at this very moment, because that's the 3 states that my company that I own, Christian Brindle Insurance Services, is licensed to work in. We're always going to be expanding. We're going to be coming to new states, and I will announce that as time comes. But right now, the 3 states we can work with you in are Utah, Idaho, and Florida. If you'd like to work with us and you're in one of those 3 states, or even if you'd like to, at least ask some questions, we always offer free, no obligation consultations. Our office number is 801-255-5340, 801-255-5340. Again, my name is Christian Brindle, folks. You are fantastic, and I can't wait to bring you another episode on Saturday, and it will be longer, I promise. Take care. Have a great week.